Welcome, everybody, to the Help for Hip Dysplasia podcast. We have with us a returning guest, Emma Howat, who is with us in the mobility aids and hip dysplasia discussion. Welcome back, Emma. It's lovely to have you.
Oh, thank you so much for giving me the time to share my experience. It's lovely to be back.
Well, I'm really, really excited about this discussion. We've been chatting behind the scenes over on a few different social platforms now, and your story has got me asking so many questions because it's something that's going to relate to my own. It relates to so many other people that I work with, other patients, sort of questions and experiences that are coming up. And I just thought this would be such a wonderful conversation to have. I'm so grateful for you being happy to share it. So just to give people a little bit of a backstory as to where we are, Emma is just out of a total hip replacement surgery. And the thing that we're going to really hone in on today is that you were awake during the surgery. So you had a local anaesthetic, and it just opened up all these questions for me. I'm so excited to learn a little bit more about your experience. But before we dive into that, could you tell us a little bit about your backstory, your introduction to hip dysplasia, when you were diagnosed, just a bit about your story?
Yeah, it's been my hip journey, I suppose if I'd call it that, is it's only really about 8 years long, which for a lot of people seems really short, especially if you're diagnosed with hip dysplasia, at birth or really early on in adolescence. So for me, it was about 8 years ago when I first started to notice, and it wasn't even a hip pain at that point. It was a pain in my inner thigh, which I thought was muscular. And I went to a physiotherapist, and they said, I think you need to go to the doctor and get a scan. For this. They thought initially it was a torn labrum. I had no idea what that was at the time. I knew pretty much nothing about the anatomy of the human body, or really, anything apart from the basic muscles that you might learn about at school. So, yeah, I went to the doctors. And at this point, I think what had brought it on was I was training for a 10K run. I was doing the Greater Manchester 10K run, which I'd done a couple of times before. I was trying to improve my speed, so I'd been doing a bit of speed work, interval training, and I'd noticed this, yeah, just this ache in my inner thigh. So yeah, that was the very beginning. When I look back, I realised that I'd had that pain intermittently throughout my teenage years. So when I was going to the gym, I'd always been quite sporty. I wasn't particularly good at sport, to be fair, but I just enjoyed it. So netball, hockey, tennis, a whole range of stuff really. Going to the gym. I was going to the gym from really early age, really, 13, 14. So, and I just noticed if I did any really kind of high intensity exercise, I did have this really, really slight hip pain, but it had never caused me any issues before. So yeah, I wasn't a great runner. I was pretty slow, but I just quite liked it. So, I was keen to keep running. But yeah, that was kind of the beginning of the end of me running anywhere, really. Went to the doctors. They referred me on to get a scan. I had an MRI scan to begin with, and they noticed, I think they did say I had a torn labrum, and I spoke to a doctor about it. They sent me for physiotherapy. They said, we don't really repair torn labrums. It doesn't often work. So you'd be better off trying to do physical therapy. So I did some of that with an NHS physio, but they just kind of gave me some stretches to do, really. There wasn't really any strengthening involved. It was still really, really hurting. And then it just gradually got worse and worse. And the hip pain, just got worse. If I was doing the garden, I'd be in agony. And I really wanted to find out what it was. So I went back to the doctor again. And then they sent me for an x-ray. And it was only when they sent me for an x-ray that, a doctor said, I think it was maybe in Tameside Hospital. I'm not sure why I was sent there, but this doctor said, I think you've got hip dysplasia. And they then sent me to Wrightington, which is, depending on where you are, you might have heard of Wrightington before, but it's kind of close to Wigan. It's kind of north of Manchester. I think it's officially Lancashire. But that's actually where they pioneered the first hip replacement. John Charnley, he was called. Don't You might know about this, Laura? Don't know.
Please carry on. I'm absolutely loving the story.
Yeah, so well, they had a little exhibition there, and this is why we know who John Charnley is. But yeah, we found out that he was the first guy that he pioneered the hip replacement in Wrightington, and it was in that hospital. So yeah, I was transferred there, and it is like the hip specialist place in the north of England. But people do go there from all over. I think they do private patients as well. But I was an NHS patient. Um, and yeah, that was when I spoke to a doctor for the first time about what hip dysplasia was. I had no idea about it before, so I kind of started researching. And this was all kind of during COVID as well. And I think that was when I found your hip dysplasia website, Laura, and I think probably on Instagram, something like that. I found it, and then obviously started paying for the Patreon, and then yeah, looking at the hip friendly Pilates classes and stuff like that, and yeah, trying to just adapt. So it's been a really long journey of me just trying to adapt my lifestyle to this condition that I found myself with. And that's included loads of things like, you know, cutting down my hours at work, you know, doing exercises every day to help manage the pain. I had to drastically reduce the amount of exercise I was doing to the point where just before my hip replacement, you know, I really was doing very little in terms of walking. You know, I've not run in 8 years. So yeah, I've not done any kind of, you know, I used to do things like Zumba, exercise classes, stuff like that. I've not done anything like that. I really had to stick to things like swimming, really low impact stuff, yoga, Pilates, and then the weights, which I've been doing most recently. That's had the biggest impact, I think, on the pain levels. So yeah, that's kind of it in a nutshell, really. It has been quite a long journey at Wrightington though, because the first doctor I saw, my arthritis, they said, is maybe in the early stages in both hips. So I only have very mild hip dysplasia, which is why it was potentially missed when I was younger. But it, you know, it was causing me significant pain. But I really had to, I felt like I had to fight really to, you know, to ask for treatment and insist that it really was having a massive impact on my life, because I suppose the x-rays and the scans showed that it wasn't that severe. So, you know, the pain I was getting didn't seem to fit, I suppose, with what they could see on the scans initially. So it took quite a while, and there's quite a lot of going back. You know, I'd do the physical therapy and then I'd go back again and say, well, it's having some effect, but I'm still struggling. So, but it was when I was referred to another doctor there, Mr. Devetcher, who, yeah, I think he perhaps works on younger patients or a lot more younger patients. So he, you know, at first he was saying, you know, I'm not sure whether you're ready for a hip replacement yet, but he did give me a steroid injection. And I went back and I told him all the things I've been doing to try and manage the pain. And he said, well, the only next step now is the replacement.
So one of the questions that I wanted to ask you is, you know, it's a question I get asked a lot by people, and it's, how do I know when I'm ready? How do I know it's the right decision? Because having a replacement is a big deal. It's a big surgery. And there's so many factors to consider. So I get asked a lot, and obviously it's, you know, it's never my decision to make for people, but the discussions that can be had are really interesting. So how did you find that process of coming to the decision of when was the right time? How did you know it was the right time? And yeah, what sort of factors did you take into consideration?
Well, I suppose one of them was that that was literally the only surgical option available to me, because they said that the arthritis was, even though it was only in its early stages, a PAO wouldn't work. You know, I was too far gone for a PAO. So I suppose if I'd found out earlier, maybe in my 20s, and I didn't have arthritis, I could have had the PAO, and that might have been an option. But because that wasn't an option, I was kind of left with this, well, either You either adapt your life completely to the pain in your hip, or you have surgery. And so I tried as much as I could to adapt my life to the pain, as well, I mentioned a few of them before, like cutting my hours down at work. But it was when really I had done as much exercise, I think, and strengthening as I felt like I could. Um, and I still wasn't really able to do the distances of walking that I would have liked. I was still coming home at the end of the day at work. I'm a teacher, I'm on my feet all day. Um, and, absolutely exhausted. So it was at the stage where I was like, well, if there is an option for surgery, why not have it now? Because I mean, as much as the doctors sometimes say that they would like you to have your hip for as long as possible, because I suppose it reduces the need for a revision surgery, especially if you're a young patient. Um, but I was just kind of thinking, well, you know, this hip would last for 20, 25 years, maybe even longer than that. And if it's going to significantly reduce the pain that I'm in, and it means that I can be more active, isn't it better to have it now, when I'm younger, and, and get the use from it? But that doesn't mean to say, I mean, that's what I think I was pushing for the whole time. So the first time I even went, as soon as the doctor said to me, stop running, that kind of spurred me on to find some kind of solution to this. I have really changed my mind actually about running. My initial goal was to get back to running, but I don't know. I think having gone through this process, I'm not sure that I need to do that anymore. I'd be happy with doing my low impact exercise, but just not experiencing the pain. I'm a bit worried about my right hip going. So I'm a bit worried. It's not really the new hip that I'd be worried about. It'd be, my right hip, which it's not as dysplastic as the left one. And I don't feel any pain in the right hip at the moment, but I just want to keep it that way. So, but yeah, I definitely, when the doctor said that I could have um, this hip replacement, there was a slight kind of thing inside of me when I thought, oh my God, do I really want this? But I just said yes anyway, because I thought, well, get on the list. You can always say, change your mind later on. But I just thought, if you show the doctor now that you're not kind of sure about it, that wouldn't necessarily be a good thing. So I was just like, yes, it's definitely what I want. And then I'm going to go and sit home and think about it for a bit. And yeah, can't say that there wasn't a moment where I didn't, every moment leading up to that operation, I wondered whether it was the right thing to do. And I think that's probably quite normal. I think what I did wonder was that, because obviously there's so many people having hip replacements who are in perhaps more pain than I was. I could manage my pain if I did certain activities or reduce certain activities. There are some people that don't have that choice, that it is bone on bone arthritis and they are in agony and they're having to rely on painkillers to even get through a day. So I think I did wonder whether for those people it was more of a no-brainer that you would just have the operation, because the pain had made up its mind for you, if you know what I mean. Whereas for me, it was, well, I can manage this pain. I can just not do this. I can just not do that. Do I want to put my body through this? There was all of those kind of considerations. So it was really hard. It was a really hard decision. Definitely.
Absolutely. I think that there's one thing that you said that really resonates with me in the way that sort of I feel about it personally from a peace of mind perspective. And that was that you said I'd done everything that I could to get stronger and to modify. So from a peace of mind perspective, I think it's lovely to hear like you'd done everything that you could possibly have done that was in your control, to adapt and to try and improve your quality of life and to try and stay as active as possible. And when you know that you've done everything that's in your power and you can sleep at night because you're like, I have done everything that I possibly could have done to the best of my ability, and I'm still struggling with the quality of life that I want, I think that that can really help make that decision a little bit easier. I don't think it's ever going to be an easy decision for anybody. But I definitely think that that helps from a peace of mind perspective to know that you've done everything that you can. So I just always think sometimes if there's still lots of options to try, or you could still have tried to get stronger, or you could still have worked on your mobility, or you could have still worked on X, Y, and Z, and you have the surgery, there's always that kind of little question mark in your mind. So yeah, I think that was something really wonderful that I heard you say that I completely agree with from a personal perspective. But everybody's decision is so different and personal to them, and it's just really interesting to hear everybody's reasoning and sort of thought processes to get to that stage of making that decision one way or another. So thank you so much for talking us through that. The next thing I really want to know about is, how did we come to the decision over local versus general anaesthetic? Was that a choice that you were given? Was it something that was assumed and talked about one way or another? Like, how did that process go?
To be honest, it didn't feel like it was a decision on my part. I think I felt like I was kind of told that this was the process. I think if they didn't really say that general was an option, um, whether I could have pushed for that if I'd have been more comfortable with it, I think maybe I could have done. Because I know that some people still do go on under general anaesthetic. But it was very much presented to me as, this is what we're doing now and this is the best. Because I think with the general anaesthetic, you'd be so drowsy, you'd be asleep, completely asleep for a number of hours. I mean, what they intended to do with me was, I was supposed to be a day case. So I was going in the morning. I was the first on the list, so I was getting my operation done at 9, with the idea that I would be leaving by 6, 7 o'clock at night, and going home and sleeping in my own bed. That didn't happen, which I can talk about a bit later on. But the idea was, yeah, if you'd had a general anaesthetic, there's no way you're going home on the same day. I, it was, yeah, it was definitely presented to me as, you'd probably be more comfortable at home, recovering at home, than you would be in hospital. A lot of people do really well going home straight away from the operation. I think when I spoke to one of the physios actually at Wrightington just before my operation, she said that they'd had about 100 patients so far on this day case procedure. So I think it's relatively new, or at least it is in the hospital that I was in. So yeah, 100 people roundabout have done it, and it's been really successful for them. So I was happy to try that. And I think because of my age, I just assumed that I would just bounce right up out of bed. That was not the case. Um, I and because I knew I would have done the prehab, I would have been as strong as I possibly could before the operation. I was happy to go through with that, and have the local anaesthetic. I was a bit I'm not going to lie, I was completely freaking out at the thought of potentially being awake during the surgery. Like, I didn't think that that could be an option for me. I thought, because they'll sedate you if you want, so you don't have to be awake throughout the surgery. They can give you enough sedation so you can kind of drift off into a sleep. And I just very much assumed that I was going to ask for that. I did think it would still be, I thought I'd speak to the anaesthetist about it on the day, see what they say and make that final decision. But I was just thinking, oh, don't stress yourself out, just get sedated, just be asleep for it, it'll be fine. But I think, and I'd also spoken to someone actually, an ex-colleague of mine met me a couple of years ago now, actually, it's quite a long time ago, when I spoke to her about it. She'd had a double hip replacement, and she said that she remembers waking up in the surgery and asking the anaesthetist, can you give me some more sedation, because I want to go back to sleep. And I remember thinking, oh right, that'll probably be me. I'll probably, if I do wake up during, I'll ask to be put back to sleep, and that'll be it. Um, so I did ask for that sedation, but I was never quite fully asleep. But once I was in the room, I don't know, the sedation just calms you down so much that I didn't care that I was awake. And I was quite pleased in the end that I was awake for the surgery. I don't know how awake I was because it seemed to go by in a flash. So maybe I was even drifting in and out of sleep. But yeah, it I was really pleased after I'd come out of the surgery that I could remember some things and I could tell people about it. So yeah, I was pleased with the way it ended up. But you can always, when you go into that room, you can always, the anaesthetist talks to you. They can talk to you throughout the surgery. So you'll discuss with them how much sedation you want. They go through the whole process of how they're going to give you the anaesthetic, and they're with you every step of the way, and they're like your kind of buddy there, if you know what I mean. And that's quite calming as well to have someone there, because you can speak to them if if you felt anxious, you could speak to them about it, and then they could presumably give you something to kind of relieve that anxiety.
So I really want to clarify for a few people. We've been talking about sort of being in the surgery and being in and out of consciousness, and being sedated. And I just want to really clarify for people what that means, because I hear that. And if I was looking at this, from an outside perspective, I'd be like, so when you're awake, can you feel everything? And when you're asleep, can you not? So I think let's talk a little bit more about the differentiation between that. So you had a local anesthetic. What happened with that? And can you explain a little bit about your experience with the difference between the local anesthetic for the surgery and the sedative part? And let's dive into that a bit more.
So they get you into this kind of little room where they give you the anesthetic, and then they take you into the surgery room, which is next to it. So while you're in that kind of little room, with the anaesthetist, and you've got other staff there as well who are going through all of these checks. They're asking you kind of what you're allergic to. They're running through your name, your date of birth, all of these things. So all of these things are so meticulously checked. I was asked what I was allergic to at least 10 times, if not 20. So like they go through everything. It's such a well-oiled machine. Like everything they do, it's amazing. And so they get you on the bed to start with, and then it's a spinal injection. So I suppose if any of our listeners have ever had children, they might have had an epidural. It's the same kind of thing. I mean, I haven't had kids, so I've not had anything like that before. But I didn't really feel the injection that much. That wasn't painful. And they just tell you that, look, you're going to go numb from the waist down. So then once they do that, then they have to lie you on the bed. And you're lying in a kind of, you're lying on your side, and then they've got like a thing for your arm to rest your arm on. So that kind of feels a bit comfier. And they basically have to check that the anaesthetic has worked. So they do that with a cold spray. So they'll spray your body and say, right, if you feel this level of cold, do you also feel it down here? And they'll ask you to like wiggle your toes and things like that, which I couldn't after, a minute or so. So yeah, that for me, that was really strange, was not being able to move my legs. That felt very odd. But it just felt weird. It didn't feel distressing. I think I was relieved once I had the sedative, because I started to just calm down a lot more then. It was just the odd sensation of my legs being numb. And I think I over worried as well. Like she'd be asking me, does this feel cold? And I'd be like, yeah. And then she'd spray it and she's like, is that the same temperature? And I'd be like, I don't know. Spray it again. Like I just couldn't, like, I was freaking out myself, because obviously I was like, well, it needs to work. Like it has to be completely numb. So she'll go down the body and you'll feel bits, and I might be like, well, I can feel it, but it doesn't feel cold. So she's like, if you feel cold, you would also feel pain. So they do all of these checks to make sure you can't feel anything before you go in. And then at this point I was like, just give me the sedative, like I just want to go to sleep, like that's fine. And then so I did get something, and then they wheeled me in. But yeah, I just seemed to be kind of quite dreamy by that point. I was really quite high, to be honest. That's how it felt. I was really kind of in and out. Like I could hear things going on. once they moved me into the room, but they put like this cover on you that's like a heated blanket, if you like, but they blow hot air through it. So actually, even though it can be quite noisy in the room, because they were blowing hot air through this blanket, that was what I could mostly hear. So I don't know, they've gone a bit off topic there. Did I answer that first question
Yeah,
okay?
absolutely. It was just, I just wanted us to be able to clarify that there's a different process for numbing everything from the waist down to then the level of sedative that you were having for your level of awareness during the surgery, and that they were two different things. I just wanted to clarify that for people in case they were thinking, oh, but then she's awake, but does that mean she can feel stuff? Like, because I think there are different levels of sedative that you can have, right? But
Yeah.
that doesn't have to relate to the anesthetics. So they're two completely separate processes. But yeah, I'm really interested in what we're talking about here. So please carry on.
So yeah, I suppose like with the sedative side of things. So even though that puts you to sleep, but I think what also it does is just calm you down. So I was really anxious going into that operation. Perhaps not so much once I was there, because it was just like you're like, right, I'm doing this now, let's do it. But all the way leading up to my operation, I was, I had been ridiculously anxious the month before, and I'd managed to calm myself down a bit in the lead up to it. But I think, yeah, the sedative really did calm me down, to the point where when I was still awake, I didn't mind being awake, and it just seemed to go so quickly. I was in and out in a flash, and I did kind of. So I suppose maybe I was in and out of consciousness a little bit, and you can't feel anything. Um, and at one point, the anaesthetist did say to me, and this is where before I'd kind of, you know, got a bit more drowsy with the sedative, she did say, like, oh, your leg's up there if you want to have a look. And I just went, no, I don't want to have a look. Thank you. No, it's going to freak me out, because when you have this anesthetic and they lie you down, you think your legs are in a certain position because your brain remembers the last position that your legs were in before they went numb. So when they move your legs, you don't know this. So your brain doesn't know. So in my mind, my legs were straight out by the side of me, but one of them was up in the air. But I just didn't want to look at it in case that freaked me out more. And I didn't want to get any more worried. So I just said to the anaesthetist, like, no, I'm fine, thanks. I'll just stay looking at this. Um, I'll just do this. It's fine. I know it's there. It was just, that was really odd. But I know some people like have reported things like that when they've been awake in surgery, and it's just like, and they're like, oh, is that my leg? Up in the air. So yeah, if you think you'd be fine with that, yeah, by all means, I think, yeah, have a look, have a look at what's going on. I mean, they put like a kind of cover over, you can't see a lot anyway. They kind of put a cover over you anyway. But yeah, when you go into the actual theatre, you can hear stuff going on. So if you are awake, they're using power tools basically. Kind of drills and things like that. So you can hear like kind of drilling sounds, knocking sounds when they're actually knocking the hip into your bone. And I could hear that. And in a way, you can sometimes feel your body being moved around, but only obviously from the waist up. So there's absolutely no pain whatsoever. I think they do just give you enough anaesthetic to get you through the operation. So it's a short amount of time. So I think it maybe lasts 45 minutes, the operation in total. So they'll give you enough of an anaesthetic to get you through that. Because after I went back onto the ward, I could start to wiggle my toes quite soon after. So it's only a really small amount that they give. And I think that's just so that they can get you up and moving as quickly as possible after the operation. So when they were sewing me up, they were doing the suture. So I had they glue the wound, and then they sew using dissolvable stitches. So I could feel that not being done, but I could feel a sting on my leg by that point. And at that point, I said to the anaesthetist, I can feel something here, you know, like a sting. Is this normal? So yeah, I was doing a lot of asking questions and probably seeming like I didn't trust him. But that was just to relieve my own anxiety. And she was just like, yeah, they're just finishing up. They're just doing the last 2 stitches. And I just kept saying, I think I was so saying like, yeah, it stings a bit. Like I said, it doesn't hurt. I said, but I can just feel something. But I think she must have been fine with that. That must have been completely normal. So yeah, and in fact, the doctor who was stitching me up was actually training. She'd come to see me before to ask if, you know, she was doing her training for suturing, and then could she, yeah, was it okay if she did that on me? And I was like, yeah, okay. So I think everyone's got to start somewhere, haven't they? But I think because it was under the watchful eye of the 2 other consultants, and she's actually done an amazing job according to the nurse. So I went to get my scar checked the other day, and she said it's very neat. So I'm really happy with that.
That's really, really amazing. Okay, so you've said that the people that are your end of the bed talk to you during your surgery. Did you have any communication from the people the other side of the curtain, you know, from the surgeons, or was it more sort of the people up doing sort of the anaesthetist stuff, the other people that were speaking to you?
Yeah, it was mostly the anaesthetist. I think when I was in the little room getting the anaesthetic, there was a kind of a guy on the computer and another woman who was kind of checking I was okay. And I don't think that they came into the room with me. I think it was just the anaesthetist, and then it was this another surgical team. So the doctor, my consultant, had come in and spoken to me in the anaesthetic room, I suppose, if I call it that. I don't know if there's an actual name for that room. But he was talking to me then, and I was telling him I thought I was going to be asleep, and he was just like, "Oh, so you're not going to be listening to my jokes then?" And I was like, "No, I'll be fine. I'll just be asleep, thanks." But then obviously after the surgery, he came to see me again, and I said, "Oh, I was actually awake for quite a bit, you know." And then again, he was like, "Oh, so did you hear some of my jokes?" And I was like, "No, I didn't hear. I couldn't really hear what they were. If they were talking, I couldn't hear them, and I couldn't see them either. So, and I think because you are so covered, like you're on your side, and all I could really see was like a machine in front of me. But I didn't make an effort to like look around. I don't know whether you could make an effort to look around. Um, Something I will say though, which was quite strange. I mean, I was told that if you wanted to stay awake, you could bring headphones in to to have a playlist, because I think they were aware that it could be quite noisy and it might relax you if you listen to music. So I was intending to take some headphones in case I wanted to do that. But then I was told at the last minute that they weren't allowing any, because my headphones are connected to my phone, they weren't allowing any phones in the operating theatre. And that's because some people have tried to film doctors whilst they're doing the surgery without asking their permission. So they've just had to ban phones in the operating theatre. So, which, I mean, I can understand that totally. It's a shame that somebody did that without asking permission. But yeah, as it happened, I didn't need any music anyway. I do remember coming round to like, they must have had the radio on because I came round to like the Backstreet Boys. That was my first like memory. It was like, I Want It That Way or something like that. And I was like, oh yeah, I'm sewn up now. And then after they finished it, I don't remember seeing the doctor, like my doctor in that room. There were lots of other staff, but they have to turn me over on the bed, and they're doing all these things with like different, machines and things like that. But it's such a, it's, you just feel very calm because they very clearly have this process that they go through for every patient, and it's almost like a kind of, it's like you want a kind of conveyor belt. They're going to get somebody else in a minute and do the same thing for them, and they've got these very, very strict routines that they go through. And you can tell that they've all got their individual roles in that room, and they work together, and it's like clockwork. It's amazing.
So the next thing I was curious about, because I do have questions about this from some people, and everybody has a different level of feeling about this. But because you're awake, I suppose there's something to be asked here about whether there's any acknowledgement that you're awake and you're not wearing anything. So how is the feeling of the fact that we're not wearing anything, but we're also awake in that same room? I think when we're under general, I think there's just sort of something that can be said. We just switch off. Like we know that we're not wearing anything. We know that we're around other people. But when we're awake, I know that there are some people that have asked me questions about this before in terms of sort of decency and acknowledgement of being naked around other people. And you know, for some people, there will be serious elements of trust to be considered from previous experiences that they may have had. I was just wondering whether there was any acknowledgement of decency or any kind of communication about that, even more so being awake in that room and being aware of it through that situation.
I think I definitely did. Like the doctor asked me, did I have any questions before I went in? And one of the questions I asked was, it was more about, I suppose it was about decency in a way, but it was more, you know, am I likely to soil myself once I've had an anaesthetic, which I was quite scared about. He said that was very unlikely, so then I felt a little bit calmer about that. I think maybe just because you hear people's stories of childbirth and that's what you associate an epidural with. Um, and I was also quite worried going into it as to where I would be on my menstrual cycle. I felt quite lucky in the end that I had just finished my menstrual cycle, so I didn't have to worry about bleeding in that sense. So they give you a gown to put on. To be fair, though, I don't think there was any real discussion or question about. I mean, I asked questions about what I could wear in there, um, and I was just told. I mean, I thought at first that I might be able to kind of walk down in, you know, knickers and a bra and just have the gown on me, but they don't allow you to do that. You have to take everything off from underneath and you just have a gown. And it's one of those gowns that they tie at the back as well. So actually the nurse did, as when I was on my way down there, I think the nurse held my gown at the back for me to kind of preserve modesty. And they did do that as well if they were helping me to get somewhere afterwards. So there was that consideration in that way. There wasn't necessarily a discussion about it, but presumably I could have asked if I'd been worried, when they do say, you know, do you have any questions and things like that. I don't think I was. I didn't think I well. It was something I think I was probably mindful of because I was joking with my friends about it prior to the surgery. So I was supposed to have my first surgery done and then it was cancelled. And just before that, I'd been laughing with my friends about it, saying, you know, oh, I just realised that I'm not going to have any pants on during this during this surgery. And is that a bit weird? And also, you have to wash with a like an MRSA solution to it's like a decolonization regimen that you have to go through like 5 days before the operation to make sure you haven't got MRSA. So you have to take very particular care about the genital area, and use this solution to make sure there aren't any kind of bugs there and things like that. So you're kind of aware of that going into it as well. But yeah, you're not allowed to wear, even if you had like a soft bra on or some kind of crop top, um, I don't think you're allowed to wear that in the surgery at all. You've got to just have a gown on. Once I was in the surgery, and maybe it's because of the sedation, but I just didn't care that I didn't have any underwear on. And part of me was just like, gosh, they must have seen this a million times before. But if it is something that you're worried about, I would definitely say, you know, ask the nurses in your pre-op, ask the doctor, you know, before the surgery. Hopefully they'll put your mind at rest. I will say that it was quite a long time before I actually put a pair of pants on. So, I mean, I could go over that a bit later, but yeah, there was some complications, let's say, that I had straight after the surgery that meant I was just in a gown for a very long time. I think it was about 2 days. I was just in a gown for in the bed. So
Thank you for telling us a little bit more about that. It's just it's questions that I get not commonly, but the questions do come up, and I just think, it's something that probably a lot of people are mindful of at some point in that process of going into surgery, but it's just not really talked about. So I just kind of wanted to bring it up, just and I think it's really reassuring what you said about the fact that they are asking you many opportunities. Have you got any questions? Is there anything that we can do for reassurance? Like that's really comforting to hear, because I think if there are people that are quite conscious about that scenario for whatever reason, at least that you've got opportunity to ask questions, and that people are being mindful about the fact that they want you to be comfortable and relaxed, and mindful of your experience. So that's really reassuring to hear. So thank you very much. So when it's all finished and done, and you're kind of being wheeled off do you go to recovery room if you've been if you're not sedated and unconscious, or do they just take you straight back to the ward?
no, I went to like another ward, a different ward, and I think that was just to have your first initial checks. So that's almost like a kind of holding bay, if you like. So you're on a ward initially. I mean, this was the case in Wrightington anyway. Obviously, other hospitals might have a different procedure, but you were on the ward initially when you first get there, when you had your bed in that room, and then that's your bed then that they'll wheel you about on. Or actually, no, I walked to get the actual operation, and then I think then they put me on a bed, and then that was wheeled back out. Um, but yeah, in this, straight after the operation, and you're kind of coming round, and they're taking your blood pressure, they're giving you some liquid morphine, because at that point the anaesthetic is wearing off, so they need to get you the pain meds as soon as possible. Um, I was quite, woozy at this point, very emotional. Really, like I just had tears in my eyes, but they were happy tears. Like I was really just relieved to have come through the operation. I was really quite excited at this point. But yeah, I had to get an X-ray, so they wheeled an X-ray machine over to check that the hip was in the right place, and then you're just kind of waiting to see if everything's all right. And when they say that's great, then you go back onto the ward for a bit. So yeah, I think I was just supposed to go onto this, the initial ward, and the physios then come to see you and get you up. But yeah, there's a few complications with that for me eventually. But yeah, that was the process there. And I couldn't, by that point, I was asking them, like, oh, will I be able to, because my wife was waiting for me in the waiting, well, I say waiting room, it was just in the cafe. There isn't like a waiting room. I think for a lot of people, they say get your loved ones to go home, because it's a full day you're in there, and you can't really have visitors until perhaps like the very end of the day. So often they'd say, you loved ones would drop you off and then go home. But I was just very mindful, like, yeah, can I contact them to say, can I contact people to say that I'm out of surgery? And yeah, they allow you to do that once you've had your X-ray.
So you said that there had been a couple of complications. Are you happy talking us through that? Was that before you got back to the ward, or was that afterwards?
Yeah, it was afterwards really. So everything went fine. Like they said, the hip's in the right place. The surgery went really well. Yeah, the complications. It was. I'm one of those people who I'm quite often anemic. I have very heavy periods, and this means that I'm always having to take iron tablets to replenish my iron. So I was a bit worried before the surgery, because they said, well, your iron stores are quite low anyway, and they're just about on the limit that we would say is okay for surgery. And at one point I was thinking, oh, I really hope they're not that low that they'll cancel my surgery, because I'd been taking iron tablets right up until the surgery. But yeah, it was okay. I had the surgery, but I think I just lost, with the blood loss from surgery, I think I lost like a moderate amount of blood. It wasn't, you know, excessive, but I think because my iron stores were already low, then I became anemic. So as a result, I then had quite low blood pressure. So the physios came round, you know, they come round really quickly. It's like after an hour or 2 hours, something like that. Kind of lost my concept of time by that point. I think they give you a cup of tea, which is the best thing, and some biscuits. So I'd had that, maybe some sandwiches, something like that. And then the physios came round and they get you out of bed straight away. So you're sitting up and they're asking you to take steps. But you have, at this point, you still have a bit of the anaesthetic, I think, in you. And I'd had liquid morphine at that point as well. So there's quite a lot of pain medication. It felt really strange to stand up. And they asked me to just take a couple of steps. But when I did that, I got really dizzy and I felt like I was going to, you know, be sick. So then they were like, right, no, get back on the bed. We'll come back in a little while. They checked my blood pressure. It was quite low. The second time they came round, I did manage a few more steps with the crutches, and I kind of went round in a circle. But then I got really dizzy again, and I had to lie down on the bed. So the physio said to me straight away, "I can't see you going home today, because if you're at risk of fainting, that could really damage, you know, the new hip. So they can't take that risk." I also had a slight complication of my bladder seemed to fall asleep. So I just couldn't go to the loo. And I was drinking loads of water and I just couldn't for the life of me go to the loo. But I couldn't walk at this point either because I'd not been able to stand up for long enough. So had to use a bedpan. At one point I had to have a catheter because I couldn't get rid of, of it myself. She had to give me a scan to see, you know, how much was in my bladder. And she's like, oh, there's about a litre in there. And I was like, I don't know why. It's just, yeah, I just couldn't. It must have been the anaesthetic, I think, or perhaps the morphine. I don't know. That was a really bizarre feeling. But yeah, so that was going on. And then the third time the physios came round, I think they just came round for like one last go. But at that point, I think quite a lot of the anaesthetic had worn off, and it was very painful to stand up at that point. And it was so painful that I just couldn't do it. I could not stand up. So even though I'd stood up previously, the third time I could not get out of the bed. So they were like, right, we'll have to come back tomorrow. We've got you a bed. You know, they put me on another ward. I was actually really lucky. I got my own private room. Like, just there was a bed free, and it was like its little room on its own with an ensuite and a TV. Like, that was so nice. I always felt very lucky to get that. So yeah, then I ended up having to stay that night, with the intention perhaps of going home the next day.
So when was the first time that you got up and felt like you could manage it? That you weren't dizzy, you weren't feeling sick, and the pain was manageable enough to be able to do it. What was that experience like?
I think it was. I think so. I was in on the Wednesday, and I think it was Friday before I could actually get out of bed, which is quite a long time. I think you know, considering I was supposed to be home on the same day, I did worry that I was taking too long to get up. And that was hard. That was really hard on the Thursday because I was still not able to go to the loo by myself. You know, I was having to use a bedpan. I think it was the Friday morning, and it was just something changed. The pain level had been really high before then, and I'd just not been able to move my leg in the way that I needed to get off the bed. It was really painful. But on Friday morning, I managed it, and I was amazed because I didn't think it's like I'd almost given up on getting out of the bed. I felt like I was not going to be able to do it. But then each day your muscles just must turn on a bit more and you just get a bit stronger, or maybe maybe it was the pain medication had, been a bit more regulated, perhaps. But yeah, then I was able to stand, and then I could have. So they kind of signed me off to stand, and then somebody could help me to the toilet. And I needed two nurses at first to do that. Then after a while, it was just one nurse, and then they cleared me to go on my own. So by Saturday morning or Saturday, like early afternoon, they'd cleared me to walk independently, and they said you can go home today then. So, but that was quite a long time in. Not, I think they mostly try and get people home the next day or 2 days in, but it just, yeah, with the blood pressure, that really did complicate things and just made things a bit more tricky.
It sounds quite reassuring that they were just happy to be like, they're doing all the checks, they're making sure that you're safe. Your safety is of, utmost concern. And, it's not like, well, do you know what, you're cope, just go home. They were taking everything really seriously and making sure that you were okay. And I think that's really reassuring to know that they're not gonna let you go home if you're not right. They're gonna keep you in. And, you've got people watching over you and making sure that, they're checking all your obs and making sure that everything is okay. And they will let you home when it's safe to do so. I think that's really reassuring to know that, even though it doesn't sound as it was initially planned that you'd go home same day, but I think it's really reassuring to know that, they're taking everything so seriously and that they are checking and that they'll keep you in as long as you need to be there to be able to make sure that you're safe and that everything's good to go home.
Yeah, and they'll check, they do the obs like every few hours. So in the night, they would have to wake me up in the night. A lot of the time, I kind of woke up anyway, and then someone would come in. It was like I woke up automatically. It's like I knew I needed my blood pressure checks. It was strange, but they'd come in every, I don't know whether it's every 4 hours, something like that, to check your blood pressure. And I had blood tests regularly, checking your temperature. So they were always on top of the observations. So that I felt I was really glad to be in hospital for those days, to be honest. You know, I think for me, I suppose if things had gone to plan and I'd not had low blood pressure or anything like that, I might have been a bit more confident. But I think maybe I'd had my confidence knocked a little bit by, with the dizziness and things like that. And yeah, I felt a lot safer in hospital for those days.
That's really amazing. So when you did go home, how was it walking through that front? Well, let's even go back a bit further than that. How was it getting in a car straight after your surgery?
That was quite hard. That was quite difficult. And I think I was just so mindful of like any kind of bumps or knocks. I was just like, drive really slowly. All the time. That was, yeah, it was tricky getting in the car, but it was okay. It was fine. It was really amazing to be home by that point. I think I'd kind of, on the Thursday or the Friday, I was thinking, oh, I could stay until the Monday. Like I don't want to rush home. But by Saturday, it's amazing how quickly things change and how much stronger you get every single day. Um, and I was so happy to be at home and in my own bed. And it was a bit of a struggle getting in and out of the car that first time. Um, and yeah, we actually borrowed Nat's mum's car because it was a much higher car. She's got a very low car, and I think that was the right decision to get home, because it was easier to get up into something than it was to go down very low. At that stage, it was still really very hard to squat. Going to the toilet was the biggest challenge. That was far more challenging than going up the stairs. I found stairs really easy to do. And I think I'd really worried about stairs. People say, oh, the stairs after you've had your hip operation, they're the easiest thing for me. I was, zipping up those stairs, but getting down on the loo or sitting down on a chair is a bit more tricky.
I think the difference is when you're going up the stairs, really, your hip is in quite a neutral position. So the leg that does the bending and taking all the load obviously is the non-surgery one, but the operated leg really just kind of has to hang there. on the way up and the way down. It doesn't really have to do anywhere near as much of the bend. So, but when you're sitting and squatting to, get off a chair to the toilet, actually there's a lot more of a hinge that happens that's going to affect the hip more. So I completely get it. But then also, there is something to be said for the fact that, you were really strong pre-surgery, and not just, lower body stuff. You trained in the gym, your arms are strong as well. So that probably really helped you with the confidence on the crutches to be able to negotiate the stairs with a little bit, of extra confidence. That's just an assumption. Is that true at all?
Yeah, I think so. I think the crutches are still pretty hard. The mind you, with the crutches, it's more my hands. It's irritating more on the hands than it is on the arms. It's not really the arms that are an issue. So yeah, it's just the gripping with your hands. So if you had them for long, but that's only really if you're going on a walk. Using crutches around the house, I found quite easy on my arms, and not really a deal. And they give you these kind of tricks as well to get up the stairs. So how to carry your second crutch in your other hand to get up the stairs. So you still got use of both crutches when you get to the top of the stairs, which is okay if you've got someone with you for the first few days at home. They can carry your crutch upstairs, or, if you've got someone to assist you. But if you're ever going to be in the house on your own post-surgery, you have to really think about these things, about where things are in the house, what's easy to grab, whether everything's where you need it to be. Do you need to take something upstairs, or, can you use it upstairs, or do you need to bring it downstairs, and things like that. Yeah, you've got to take all that into consideration, definitely.
Is there anything sort of with that in mind that you think would be really useful for somebody who was about to go into surgery to consider? Anything that you can look back on and be like, oh yeah, that was an absolute game changer. I really needed that, or I needed to buy two of these so I could have one up and down, or, was there anything about logistically that you just wish you'd have either known about, or you think, I really want someone else to know about this?
I think I wish I would have bought a hip kit before the surgery, because I asked the hospital about it, because you'd mentioned it to me about the hip kit, and they'd said no, we don't, we don't give those out anymore, and they'd kind of made out that I wouldn't need it. But I think it really depends on how much assistance you have at home and how long you might be on your own for, because it's been a bit of a lifesaver, the hip kit. So in that hip kit, that's on your kind of Amazon page thing, there's the grabber, which what I've used the most, I think, is the grabber, and like a hook. That's really handy for putting on pants, and then there's the sock thing, which is so good for putting socks on. That's the best thing. And actually, I've spoke to some people as well that, there's all kinds of people that really struggle to put their socks on. People with back pain. I really think it should be publicised more. It's amazing. And then it's like a giant on the hook. There's also the shoe horn, which I was using a shoe horn already. But yeah, I was just thinking, God, probably should have had a hip kit in anyway. If you do have hip dysplasia or any other hip issue, and you struggle to touch your own toes, like, you're going to struggle with all kinds of things. So yeah, having a hip kit at home can just be really, really helpful. And I suppose a lot of it is really just a learning curve. So I did think prior to it what I might need around me. But I think because I always was going to have somebody there with me in the early recovery stages, I knew that someone could just get stuff for me. So I think it really depends on your home setup, whether you've got people to assist you, who's coming in. If you know that it's going to be tricky to get people to help you after your surgery, definitely try and book that all in. I suppose it was different for me because I was supposed to be home on the same day. So, my wife had taken time off work to be with me at home, but that ended up being with me in the hospital. She had to take an extra day off work on the Monday to be with me at home, and then my mum came on the Tuesday. And then by Wednesday, I was able to spend a little bit more time on my own. So, and my mum came again on the Thursday. So, yeah, and then I had like friends coming on the Friday as well. So I had somebody in with me every day for that. I suppose like for the first 2 weeks, if you need, you might have children, you might have another kind of family set up, all of that would need to be quite meticulously planned for some people. With me, it was okay. I just rang my mum, was like, can you come on these days? And she was free because she's retired. But if you know that people have got to give up work, to come and help you, then that really needs to be in place, I would say, before. So yeah, it really just depends on your individual situation.
They're great things to consider, though. Thank you for sharing those. So, I mean, I guess we're 2.5 weeks post-surgery now. So, when you look back over the experience, how do you feel about it? How are you feeling about sort of everything going forwards? Where's your mindset?
It's amazing what I mean, lots of people a lot of the time always, I've heard this phrase said, like, the body always remembers. Um, and a lot of, that can be, things that have happened to you in the past. But I also think it's really clear that the body also seems to forget. So when I was in that hospital bed and I couldn't get out of bed, and I was just, I was really upset. And it's amazing, 2.5 weeks after that, it's like I've almost forgotten it. Like, I've forgotten the pain that I was in. I've forgotten, even though, I do know, and I will tell people, yeah, it was really painful. And I had to make sure that I, kept on top of the medication, to make sure I wasn't in, really, really bad pain. But when you're through it, you're like, oh, I could do that again. I remember when I got out of the surgery and I was thinking, I don't want to do this again. But it's amazing, once you come out of it and you get stronger every day, you say, oh, if my right hip needed doing, yeah, I'd just do it. And that is amazing, really, like how your body adapts to a new situation. I mean, obviously, I still have to. There's a lot of recovery time left, and I'll still have to see, how I go on with this hip. But yeah, that's what's amazed me the most, is just how much more you can do every single day, and how your body changes every single day and how it recovers from, I suppose, yeah, because you're really swollen on the first few days, the first week, like really swollen, and it's gone down so much now. So every day I would wake up and something looks kind of different, and feels different every time. So yeah, that's kind of where I'm at the moment. It's nearly 3 weeks. So on Wednesday it'll be 3 weeks. And I've already been out of the house, like, for a little, went for brunch yesterday. So I'm managing to get back to some activities, not very long activities. It can be like an hour, couple of hours out of the house, at the moment, but slowly but surely you see kind of normality returning. So that is really promising.
It's really exciting to hear how you're feeling about it now, that experience, the being able to say the memory of it, but also knowing that the experience has been positive enough for you that you're like, okay, well, if the other one needs doing, I feel okay about that. So I think it sounds like it's made you less anxious about having to have another surgery in the future from the experience that you've had, and that's just absolutely wonderful to hear for you. I'm so happy that it's gone the way that it has for you, and I'm so grateful for you really sort of doing this deep dive with me. We've really sort of delved into the depths and the detail of this surgery and this process in a way that I don't think I've done before on this podcast. We've really kind of got into the detail of the surgery, and I'm so grateful for being able to have that sort of extra level of understanding about your experience, and I think there will be other people that really appreciate that too. So thank you so much for your time today. Really appreciate it. Have you got any last messages that you'd like to leave for anybody that might be listening that's coming up to this surgery?
I wrote a couple of things down just to make sure I didn't forget. I think the main thing that I took from it all is that you have to advocate for yourself, and you have to communicate how you're feeling and what you need at every stage of of this journey. And if you know, right from the very first consultation that you have with a doctor, where they might say, you know, you've been given the diagnosis of hip dysplasia, for example, um, it's it's really hard to do, actually, because, you know, there's different people in all kinds of different situations, you know, people in different countries with different health systems and services, and you're having to navigate a really complex um, system, basically. But I would say, do your research, ask as many questions as you can, but also say, yeah, tell people how you're feeling about it. And I think sometimes you really have to not beat around the bush, and, you know, tell people exactly what you need, because I think sometimes if you don't do that, people assume that you'll be okay without it. I think that was the case for me with medication, like making sure I had enough of the pain meds after straight after surgery. And I think I maybe left myself, you know, I let myself go a little bit too long without a bit of pain medication, and then I had a bit of breakthrough pain, which was really hard to manage. And I think asking the questions beforehand might have been good for me, I think, straight after surgery. So just saying, right, how often do I have this pain medication? If I'm in pain in between those times, what do I do? And making sure that's really clear in your mind, because obviously the nurses are coming around all of the time, but not all of the nurses have the responsibility of giving out pain medication. So some nurses are just, or they might have different job roles, to be fair, but so, you know, some people are there to give you food, some people are there to just check your overall well-being, some people are there to change your bed. So there's all kinds of different roles that they have, and it's really hard to know who can do what sometimes. And yeah, they were probably glad to get rid of me in the end, because I think I was quite demanding. But I just had to be like, well, no, I can't do this. No, I can't get out of bed at the moment. No, I can't sit up properly. You know, and I was always grateful, and, you know, when I was, you know, told them how thankful I was. But yeah, I just had to ask for things to make sure I was comfortable. So that's kind of like, I suppose, the one takeaway. But, you know, the NHS is amazing. Like, I got the best treatment. It was just unreal. So yeah, I can't believe what they can do. Like, the technology is brilliant. Oh, there's one more thing, actually. If you are like technically what they'd call a young hip patient, ask about custom hips, because that's what I had. So I have a ceramic hip, and they did lots of scans beforehand to look at how my anatomy, so how I sit down, how I, you know, when I put my leg up, you know, what's going on with my hips, and it was measured specifically for that. And I think they did ship it from the US, actually, which is why I had to wait a bit longer for my hip. But, you know, the technology is out there. It is on the NHS. So yeah, ask for it. Ask, you know, and ask, you know, what options there are, really, before you enter into something like this, because it's a huge operation. It's massive.
That's amazing messages, Lee. Thank you so much. So yeah, we'll wrap this up now, but I am so grateful for your time, like I said, and all the level of detail that you were happy to share. So thank you so much for your time and for coming back onto the podcast as a returning guest. Really appreciate that too. So yeah, thank you so much for your time, Emma.
Thank you very much for having me. It was great to share. I just hope it helps someone that might be going through it, because I was really anxious before my surgery. So yeah, if it helps someone to be less anxious and just gives them a bit more information, then I'd be so happy.
Perfect. I think it's done exactly that.